Hammanskraal became sort of a political battlefield for that time. And here to give you the lowdown of what transpired there following the independent investigation into the whole disaster. The leadership from the Water Research Commission, and starting off with Dr. Mulanto, and then she will then take it from there and introduce various other speakers who will take you through the report. Over to you, ma'am.
Okay, thank you. Good morning and welcome everybody to this briefing. My name is Jennifer Mulanto and I'm here with the team from the Water Research Commission. We are here with a team of experts that supported this study, as well as an advisory committee members that were part of this project. As we all know that the recent outbreak in Hammanskraal was triggered by a case traveler allegedly from Limpopo, which was confirmed on the 15th and 18th of May 2023. Post that event, the WRC was commissioned to, on the 31st of May 2023, through a directive from the Department of Water and Sanitation, to undertake an independent study on the source of the cholera in order to ensure that there is an independent view and the public can be given a report with regards to this. Unfortunately, by the time we started the study, already 20 deaths had been reported, and since then more were reported. The Water Research Commission is a Schedule 3A national entity which is mandated to provide research, development and innovation for the promotion of research in connection with water affairs in the country. Since its establishment, the Water Research Commission has given dedicated focus to the generation of critical water, sanitation and hygiene knowledge and innovation, which supports disease prevention, management, especially those that are waterborne and sanitation related. We have in the past done some impactful initiatives, including the design and development of the National Water Resources Quality Monitoring Program, which is being implemented by the Department of Water and Sanitation. We have also developed manuals and guidelines for municipal and household water treatment. We have deployed safe and water efficient sanitation technologies in response to the prevailing service delivery challenges. We have also designed and continue to pilot National Water and Wastewater Surveillance Program. Thus, the WRC is a science-based and evidence-led organization, and it prioritizes and relies on scientific research and empirical evidence in all aspects of operations, decision-making, and practices. In this regard, I would first like to acknowledge the role of the Water Research Commission funders, which is you, the public, who are paying the water research levy, the community of scientists and researchers for their role in the study, the team led by Dr. Nontantla, as well as Dr. Eunice Ubomba Jasa from the Water Research Commission, and our advisory committee. Dr. Eunice will now take you through the presentation of the findings of this study. Thank you.
Morning, everyone. Thank you, CEO, for that introduction. I think maybe before we start, on behalf of the CEO and the Water Research Commission, we would like to obviously offer our condolences to those who passed away in Hammanskraal, and to those who are still sick or recovering. We do wish them a speedy recovery. So this morning, basically my task as a research manager at the Water Research Commission is to really just present some of the outcomes that have come out from the independent investigation that we conducted in Hammanskraal. And just to set the scene, it's basically looking at the potential of cholera as a source from water. That's what we are focusing on for today. So in terms of introduction, I just wanted to first make sure that all of us in this room have an understanding of what exactly we were looking for in our source water. And what we were looking for is the bacteria Vibrio cholera. And specifically, we were looking for the toxigenic strain of that bacteria. So cholera is a diarrheal disease. You get cholera when you are exposed to fecally contaminated water or food, or if you are exposed to somebody who has fecal contamination on their hands, who then touches you, and you unfortunately put that and you're able to to put that on your mouth, and you're able to also get infected that way. So the routes of infection for the organism can be very different. It can be from water, it can be from food, it can be from each other. The diarrhea that's associated with cholera is very severe, so it kills in a very short period of time, and I think that is something that is very different from other waterborne diseases that we would have in the country. So the response is very critical there. Then in terms of also symptoms, what is also important is the fact that not everybody who has cholera will show symptoms. So just because a community doesn't have cholera cases doesn't mean that there might not be cholera. Then most importantly also, those who are still infected can shed cholera bacteria in their stool samples as well. So once again, making sure that people don't come into contact with their fecal matter is really, really important. In terms of the indicators that we use E. coli as a representative to make sure that the water or the environment that we are testing doesn't have any fecal matter in it. So we don't test for cholera regularly, and I'm sure if you look at the South African water quality guidelines, cholera is not there, but we use E. coli as an indicator for that. So the life cycle, you have aquatic reservoirs. If you come into contact or you ingest water with cholera in it or food, it goes into your system, and that's where it grows and that's where it multiplies. So in our aquatic environment, it doesn't multiply, it stays there. But once it reaches a human body, it then multiplies, you get diarrhea. And obviously, if stool unfortunately gets into our water resources, then anybody who comes in contact with that stool, there's a likelihood that you might get the organism. So what we were looking for specifically in this study is to test our sources to make sure that there was no toxigenic form of the Vibrio cholera strain. I think that's what's important here. Then in terms of the background of the cholera outbreaks, I think it's important for us to know that cholera is raging globally. Last year in October, the WHO announced that in terms of threat, cholera is a high global threat. So there were lots of countries that had not reported cholera before, and now they are reporting cholera. If we come down to the Southern African region or even the East African region, we see that in about March, so that's about 2-3 months ago, there were lots of outbreaks surrounding us. So we had Tanzania, Zambia, Zimbabwe having an outbreak, and then most importantly to Malawi. And Malawi currently has the largest outbreak on the continent as we speak. Then when it comes to South Africa, we had an initial case reporting, and this data we got from the NICD and obviously Department of Health in February, where there were 6 cases that were confirmed to be cholera, and 3 of those cases came from outside the country, whilst 3 of the other cases were acquired locally. And I think also if you had heard the reports yesterday as well as this morning, there's also been another case that has been confirmed as a guy who traveled to Pakistan and came back. So you can see that we do have cholera outside, and there's the potential for cholera to come into the country in a different way or into our communities. I think it's also important to know that South Africa is not endemic for cholera. It's not something that we see regularly. Most of the outbreaks that we've had so far have been linked to importation events. And also, we have a new strain that is moving around, and the NICD confirmed that, and that strain has not been seen on the African continent, and it originates from Southeast Asia. So preventing and managing of cholera is also really key, because it's what then prevents us, even if cholera comes from wherever, to protect our public from getting the disease. The important thing is making sure that there's access to a continuous supply of safe drinking water and sanitation infrastructure, so that people are able to flush away their fecal matter or to use safe sanitation facilities like pit latrines that make sure that their fecal matter is contained, it's not exposed to the environment. They're able to wash their hands as well if they do come into contact with their fecal matter. So our infrastructure must be maintained. Wastewater, which obviously gathers up all kinds of waste from different households, also needs to be treated appropriately, because that is where you would find basically organisms from our fecal matter. Drinking water also has to be safe, and we have the South African the SANS 241, which is our drinking water quality standards, which we follow, and we make sure that there's no E. coli in there. Monitoring of climate variables is also really important for cholera. We know that heavy rainfall is linked to increase in cholera outbreaks, as well as drought, because there's a minimizing of water that is used. improving access to oral rehydration solution is also really key. So cholera is a disease that can actually be controlled if people have quick access to treatment. Infection prevention control in our healthcare facilities. Once again, it means that our healthcare facilities must be able to have good quality water to use. And then risk communication to our communities, to make sure that the behavior patterns that they are involved in do not exacerbate the spread. So I think in terms of that background, then I can launch into the work that we did, because it does give the context from a scientific point of view and a methodology point of view why we asked certain questions that we asked. So we received a directive from the DWS, and then the Water Research Commission developed a terms of reference from that directive. In that terms of reference, we did appoint an advisory panel made up of 8 individuals located all over the country, and then we also got information in terms of public health information from the National Institute of Communicable Diseases as well as Department of Health. Then we had our work package teams who are with us here today, Cubic M Africa, who were looking at the risk mapping of water sanitation and hygiene services in the Hammanskraal area. We had virtual consulting engineers who were assessing the functionality of our drinking water treatment works, Temba, and then also the functionality of the 2 wastewater treatment works, Temba and Royville. We had the University of Pretoria who were then exploring the link to food, so they looked at irrigation water quality. And then also importantly, all samples were sent to accredited laboratories to be able to detect the toxigenic Vibrio cholerae strain. And with that, I want to say that in the country right now, we have about 2 of those labs, and we used 1. But in terms of using our indicator, E. coli, we do have sufficient labs that are able to monitor for that. The investigation questions that were asked were, what is the status of the provision of safe water and sanitation as well as solid waste management in the area? Could that have led to the spread? We also wanted to understand the general level of public awareness. So the importance of WASH, was it known in the community? Do they really understand how the disease is spread? We also wanted to understand the climatic conditions in Hammanskraal, because like I mentioned earlier, climate is really something that is important when it comes to the spread of cholera. Then also specifically at the time of the study, because we do know that organisms do not last forever in environments, especially our organisms that cause diseases, they are actually very fragile. So at the time of the study, we wanted to understand whether we could detect cholera in any, Vibrio cholera in any of our water sources. And if so, is there a likelihood that you could get disease transmission from that? Then also, most importantly, because I think this is where a lot of the questions have been around, what was the functioning of our wastewater treatment works? Were they also responsible for spreading cholera? Because obviously, if they're not treating wastewater adequately, then there's a chance for that. And if so, were they also treating water to the acceptable effluent or standard limits that we want? So we can now just head into the results since we've gone through the investigation questions. So in terms of our climate variables in the Hammanskraal area at the time of the outbreak, there was above average rainfall. In fact, in the month of February, we received about 3-fold what the rainfall usually is in that area for that month. Air temperature was also favorable for the growth of the organism. So that means that if the organism was in the environment, it would survive, right? And then also in terms of the presence of blue-green algae and water hyacinth. So we do see a lot of blue-green algae on our dam surfaces, and blue-green algae and water hyacinth were both present in the Lucal Dam where abstraction takes place, as well as the Penis River. And those algae, as well as the water hyacinth, we know that they are carriers of Vibrio cholera, so the bacteria likes to attach to them. So in terms of our environmental conditions, it was favorable for the survival of the organism if it was present in the environment. If we look at the runoff from solid waste dumps as well as sewage overflows, so in that area, there are a lot of illegal dumping sites. I think our work package leaders could confirm, I think there were definitely over 50 illegal dumping sites in that area. And a lot of these dumping sites, unfortunately, also have some nappies and stuff on them, which obviously has a fecal component to that. And then on top of that, too, there were sewer overflows as well happening in the community. What we did find, though, was high levels of E. coli in all the samples that were analyzed. We also found 2 other bacteria that do have the potential to cause gastrointestinal disease. It wasn't confirmed that they did, but they do have the potential, Salmonella and Shigella. But then we also did not find cholera in any of these sites that were monitored. Then looking at the water sources and storage facilities in the Hammanskraal area, you will see that there's a whole range of different kinds of sources. So some people get their water, the RDP, those living in the RDP and township, they do get some of their water from the Temba drinking water treatment plant. Some get from a Rand water pipeline through tankers. Some get from the Cliff Drip water treatment plant, and then some also buy bottled water from stores, and then some have their private boreholes as well, where they access groundwater. This slide is really important because in an outbreak, you want to be able to quickly identify the source. And if you have a community that uses various types of water from different sources, then it's very difficult to track that outbreak. So in the case of Hammanskraal, this would be a situation where it would be very difficult to track where the source would be coming from. Secondly, also, when you do store water at home, it increases your chances of contaminating that water. So then if you do have cholera present, then it spreads easily. In this case, also, you also have intermittent supply of water. So it's not just the quality of water that is really important, but it's also the amount of water that the community is receiving, which is really key. Then we also looked at the assessment of sanitation and hygiene facilities. So like I emphasized earlier, you do want to, as much as possible, keep people away from their fecal matter because that is where the organism resides. In Hammanskraal area, you have flush toilets inside the main house. You do also have some flush toilets that are located outside. You also have flush toilets that are located in the dwelling. In all these sanitation facilities that were looked at, and none of them really can be considered improved because in some cases water was not flowing, so people could not flush. In some cases, they're not like there are a huge number of people sharing one facility. So for instance, in a case where the flush toilet is not working, then people will have to resort to other sanitation facilities to use, for instance, like a pit. In the pit latrines that were found there were no hand washing facilities for most of the households, or they were very far away. So that means that even if people had diarrhea, they can't wash their hands immediately. It takes them a long distance to travel to wash hands. There were also chemical toilets as well. Once again, no hand washing facilities, and we do know that is important to stop spread. And then flush toilets also were connected to septic tanks with limited wash basins as well. In terms of finding the bacteria in the Apis River, so the Apis River is a river that runs in the Hammanskraal community. There was Vibrio cholera detected only once in a grab sampling that was downstream of the Hammanskraal area. We did not find any cholera, which was upstream, from the sample upstream, the Rooiwal wastewater treatment plant, as well as the Leeuwkrul Dam. In terms of downstream of Rooiwal, there was also Salmonella and Shigella, another 2 organisms that also cause diarrheal diseases. And then there was also a very high concentration of your E. coli bacteria. And like I indicated earlier, that E. coli is the bacteria we use to check if fecal matter might be present, and it was very high. So in terms of actually using the Apis River as for recreational activities, for cultural activities, for religious activities, which we know that the community of Hammanskraal does, we would say that those activities really put them at risk because they are unacceptably high levels of E. coli in that water, and we would urge that the community doesn't do that till that water quality of the Apis River improves. So now looking at our irrigation water, so there are a number of farms, and some of the farmers do use the Apis River as their source for irrigation water, or use sprays that offshoot from the Apis River or from other rivers upstream. And in the case we have found Vibrio cholera, we are still in the process of making sure that it is a toxigenic producing form, but it was found in one sample that was located in the Cal Plus Sprait irrigation water point. Strait. And just upstream of that strait is a burst sewer pipe. So, I mean, obviously the thing is to understand whether that burst sewer pipe has cholera, Vibrio cholera, which obviously is then feeding into the irrigation water in that strait that the farmer is using. The water that is being used there is to irrigate a pea farm. So you do have a pea farm there. We know that peas at least are a shelled crop and they need to be cooked before eating, so that reduces the risk there. And then if you look at the strait also flows into the Apis River, which obviously is further downstream the Hammanskraal area as well. And then in terms of the Temba drinking water treatment plant, so in my earlier slide, I indicated that some members of the community receive their water from Temba. So Temba, obviously this is a summary of the results, the detailed results that virtual consultant engineers have provided with regard to the treatment plant. But the plant is operating below capacity. The drinking water standards in terms of SANS 241, unfortunately the plant doesn't comply with that. We didn't find any Vibrio cholera, however, in the raw water before chlorination and also after chlorination. This is a very summarized version of some of the critical issues that the plant is undergoing or is experiencing, but breaks in chlorine disinfection is a problem because you do want to make sure that there is the right amount of free residual chlorine all the time in the water. Chemical dosing is not just chlorine that we are focusing on, but there are other chemicals that are also important to make sure that the plant is producing water of drinking water quality standards. So other chemicals are also not being optimized. And then there's also just a general lack of proper process control and operation in that plant. Then in terms of the wastewater treatment plants, Temba wastewater treatment plant. Temba is the plant that takes wastewater from the Hammanskraal community. The functionality is partial, but the effluent does not meet standards for release. We did not find any cholera there. Critical issues for to sort of bring Temba up to speed is a lack of maintenance, and in some cases there's partial construction of some of the components of the plant. Then in terms of the Rooiwal wastewater treatment plant, Rooiwal wastewater is actually made up of 3 different works: Rooiwal Northern Works, Rooiwal Eastern Works, and Rooiwal Western Works. I mean, that plant is completely dysfunctional. This was not only found by our investigation, but I think it's been reported nationally as well. Effluent does not meet standards of release, and if you looked at the Green Drop Water report that was released earlier this year, the Northern Works was classified as high risk. Cholera was not found there, but I mean, obviously very high levels of E. coli. In terms of the critical issues, I think the problems are arising in terms of the non-functionality of Rooiwal have been well publicized, but the plant is operating above its design capacity. Large sections of the plant need to be overhauled, and in general there just needs to be a new master plan designed around the plant to make sure that it functions properly. So in terms of conclusions, we from this investigation can say that it remains unknown whether the water was the source of the cholera outbreak, but we do know that at the time that sampling was taking place, there was Vibrio cholera circulating in the environment, and that is because obviously we got the grab sample downstream of Hammanskraal. However, if there was cholera in the environment, however it came into the community, the conditions in Hammanskraal do aid in its spread, because if we look at the water sanitation and hygiene issues in that community, we find that there's operational inefficiencies of the Temba and Rooiwal wastewater. That means that wastewater is not being treated. The community could be exposed to that because of the Apis River. They are also not receiving drinking water quality standards from the Temba water treatment plant. There's a lot of illegal dumping and poor solid waste management, which contributes also to the spread of our bacteria. High levels of fecal contamination in the Apis River, and by that we are monitoring for high E. coli levels. There's obviously inadequate sanitation and hygiene infrastructure, especially in the informal and rural settlements. And then there's just generally a lack of awareness around the risks that lack of wash services pose. So understanding the different sort of pathways that I talked about. And this is not just in relation to cholera, but it's also for all waterborne diseases as well. So our recommendations then is to really make sure that there's a proper waste collection system in the area. Sewage infrastructure must be maintained, bearing in mind that we do have now extreme weather fall patterns. We don't know when the next heavy rains, for instance, are coming. Sanitation and hygiene facilities that are available need to be maintained, and I think that's also an issue in the Hammanskraal area. Like I pointed out, they have flush toilets, but then they don't have water for flushing. So basically it's almost like you don't have any sanitation facilities. Then effective source water protection measures are really important, because where you're abstracting your water from, like the Luripil Dam, need to be protected to make sure that you don't also overburden your plants when it comes to treating water for drinking purposes. Timber drinking water treatment plant must be operated according to standard procedure, and I think the Blue Drop requirements outline exactly how drinking water treatment plants must function. In relation to also the Rooiwel and Temba wastewater treatment plant works, Green Drop also requirements state exactly how what standards the wastewater treatment plants must meet. So with Rooiwel and Temba, they need to be refurbished and recommissioned urgently to prevent the environment, especially the Apis River, from turning basically into a sewer, and then upgraded, and ultimately to make sure that you achieve best environmental practice there. Then there should be a quick response from a multi-sectoral team when outbreaks occur. Like I mentioned earlier, there are different routes through which people can get cholera. It's not only from water and food, even person-to-person interaction as well. But once cholera is here, there needs to be quick response in terms of making sure that people have access to treatment and so forth. Risk communication also to the public is very important. And I think here I just want to stress that a lot of gains were made during COVID-19 in getting our public to really understand how disease transmission works. And I think it's something that we need to capitalize on. Our communities have the ability to understand this knowledge, and we shouldn't lose that momentum that COVID-19 brought in terms of knowledge assimilation. So with that, I would just like to acknowledge Cubicam Africa, who did the WASH risk mapping, virtual consulting engineers who looked at our treatment plants, and the University of Pretoria, who looked at irrigation water quality. I would like to also thank the advisory panel. Like I said, there are about 8 members of the advisory panel, but today with us here is Ms. Leanne Kotze and also Prof. Panis Venter. Then all the personnel at the various plants who provided information and data, as well as obviously the community of Hammanskraal. I also want to just end that, like the CEO of the Water Research Commission alluded to in her opening, the WRC has a lot of knowledge, and we have an open public platform that anybody can basically access this knowledge through. So if you go to our website, the Knowledge Hub, you should be able to access information and download that information with regard to any water-related research. And with that, I would just like to thank you all for listening.
Thank you, thanks, Doc. That, colleagues, is the results on the independent assessment of the water in Hammanskraal following the outbreak of the cholera in May. Time for questions and answers from the panel, and that applies to France, the people that have joined virtually. Who takes the first one? Any questions? Yes.
Hi guys, I'm Mariska from The Citizen. So I wanted to find out, we've seen all of this, we hear you guys, but at Rooiwel, when the president visited there, to check it out, I remember that, everyone was following the president to the Temba Stadium to listen to his speech. And I stayed behind and I walked around the Rooiwel plant, and I discovered the pipe where all the dirty water is being dumped into the Apis River. It's this big of a pipe and there's water going in a speed into that river. My question is, who's going to do something about this? If it's not donkey talk doesn't be cholera, but I mean, what I saw there scares me. So, who's going to do something about it?
Okay, we'll take at least 3 at a time. Any more questions for this round? Yes.
Yes, it's Lerato Motsa from Power FM. I'm also a resident of Hammanskraal. I just wanted to check, with regards to your investigations, did the tests from the water supplied by the city via water tankers, was that conducted, and what was the results coming from that? And also, did you also include the water that's actually being bought from your spaza shops as well? Future investigation from Parliament.
Okay, one more? France, any question? Okay, well, let's allow them to answer the two for now.
I'll just take the first one.
Yes, thank you very much for the question around who's responsible for changing the situation and doing something about it. I think in South Africa we've got a very unique obviously the infrastructure around who has the responsibility. So at the national level, the custodian is the minister through the Department of Water and Sanitation, and basically, most importantly, they are responsible for water resource management, planning, and making sure that there's water. Then you go to local government, where municipalities are water service providers. So they are responsible for water provision. Where do they source that water from? They would get it from the water boards, who then abstract, treat, and then sell it to the municipalities, and then the municipalities would obviously then distribute it to the people. We also have got, in between that, what we call water service authorities. So it is in the Water Services Act. The authority would, in essence, have to have oversight over the water service provision. And unfortunately, in South Africa, you find that most cases, the very municipality that is a water service authority is the water service provider. So who's policing who? That is the first part. But in terms of the infrastructure, at the current moment as it is the responsibility of the water service provider, which is the municipality, to provide drinking water and proper infrastructure. When there is infrastructure in this condition, the municipalities would apply to the Department of Water and Sanitation. They would use their water infrastructure grants to be able to upgrade the water treatment works. So I think we'll also have one of the service providers also commenting on that. But this infrastructure dates back prior to 1994. So in essence, the minister is empowered to take over the powers of the water service provision, to repair the the wastewater treatment works, and to hand it and then to be able to hand it over, similar to what you'd say is an administration function of a municipality. But it's very difficult because the water service provision as a function of a municipality, it's not a standalone. So you would not have the budget, you would not have the people, you would just literally have the power. And therein lies the challenge. And I think from other work that we have done at the Water Research Commission, we've said it is critical to relook the business of water service provision for safety of people. Maybe it does not lie within the right sphere of government at local government. So the responsibility to fix wastewater treatment works and ensure that people get healthy water, it's the municipalities. But at a higher level, there is potential to take over and implement. And I think there has been commitments that have been made around the overhauling of the treatment works and making sure that people get clean water.
Okay, thank you, Lerato, for your question.